Good afternoon. My name is Marilyn Rantz. I'm a professor at the University of Missouri, and I'm delighted to be here with you to explain the Quality Improvement Program for Missouri and a recent evaluation that we did of the program. So this presentation will discuss a longitudinal evaluation of the QIPMO program for the state of Missouri. And there are several people on the team that were a part of this evaluation, and they are listed here. Most of them work at the University of Missouri, where I do, and also at the University of Wisconsin, Milwaukee, and the School of and at Washington University. Please send any communication to me, and my email is there. I will be happy to respond and address any questions that you might have or help you make any contacts that I can help facilitate. So, why a state-based program to improve quality in nursing homes? Well, it's important that staff in the nursing home have people they can trust. And it's important for the QIPMO staff or people who are going to help the folks in nursing homes be regionally based so that they can help people within their own region and develop a relationship. And what they do is they provide the best clinical practices, providing evidence-based practice to all the homes. They provide help with leadership and questions about leadership and how to do things more effectively to guide their employees. Questions about infection prevention and the best approaches to use for infection prevention. Some readiness help to be able to be ready for state and federal surveys. People are always worried about performance for their surveys. Also, we provide MDS education. That's the assessment information that all the nursing homes in our country do collect. In many nursing homes, many do in the different European countries and others around the world. And how to use quality measures derived from the MDS data in quality improvement activities. The QIPMO program itself has actual interventions that we tested in a randomized clinical trial in nursing homes. And based on those positive results, the QIPMO program began as an official statewide collaborative program sponsored by the Missouri Division of Aging that regulates nursing homes and provides oversight, and the Sinclair School of Nursing in 1999. So we've been in operation now for 25 years. The regions of the state are served by 5 nurses, 4 nursing home administrator coaches, 3 nurses specializing in infection prevention. The size of the state is approximately 68 to 69,000. There are currently over 1,100 long-term care facilities in Missouri, including over 500 skilled nursing facilities, 24 intermediate care, 369 residential care, and 268 assisted living facilities. We make a lot of contacts throughout the state, including hundreds of site visits to different facilities within the state. And within each year, we make sure we contact and assist every nursing home in the state. This gives you a context of where Missouri is and the size of our state. We're a fairly large state in the middle of the country in the Midwest, west of the Mississippi. In 2022, the National Academy of Science and Engineering and Medicine, of which I am a member and was a member on this committee that developed this report, recommended that the states develop and operate state-based technical assistance programs to help nursing homes improve care and operations. The QIPMO program is a model program that was recommended in the report that's delivered this service for 25 years. We wanted to evaluate the program again to make sure that I could talk about and others could talk about the QIPMO program with current evaluation data supporting that it does improve quality of care. So we analyzed all the Missouri nursing homes who have access, and at that time of the evaluation, 510 had access to the state, to the QIPMO services, and all of them use some service within the 3-year study period from 2020 to 2022. We pulled the data from the CMS publicly available website and the nursing home characteristics data from other public websites. We wanted to document these methods so that they could be duplicated by other states as they, or country, other states, and hopefully methodologies might be able to translate to other locations in other countries. We used 8 key clinical care quality measures: activities of daily living, catheters, urinary tract infections, antipsychotic use, locomotion, high-risk pressure ulcer, emergency room visits, and hospitalizations. The baseline facility characteristics that are typically stable were urban and rural, ownership and bedside. They were examined, as well as facility level variable characteristics, occupancy, staffing, 5-star rating. So those were the things that we did evaluate, the data we used. So the first question, did the overall quality improve? The answer is yes. To answer this question, we calculated what we call the composite QM score, taking all of those quality measure that I listed in the prior slide, and we analyzed that data as a composite for all the nursing homes in the state over the 3-year period. And you can see from this graph, there's time across the bottom and the scores across to the horizontal axis. And you can see the actual scores quarter by quarter, year by year, and you can see the regression line of the trend. And definitely the trend line is going down, and that's a good thing, because as quality measures, as the scores go down, the lower scores are better. So it's kind of like golf. You want those lower scores better. So then we divided all the nursing homes in the state into 4 groups of intensity of use of the services of QIPMO. So we calculated that using data from our facility contacts that were on-site visits, phone calls, emails, webinars, and the nursing homes were divided into quartiles based on the use of services. So that divided them evenly into quartiles. And we found a difference across these quartiles. The first group is the one that used the lowest amount of services. And they actually started, because again, this is the scores and this is time across the bottom. They started with the best score and ended with a better score. They all did that. But, and then number 2, group 2, actually used a moderate amount of QIPMO services, and they started at the worst score and improved the most. They had the steepest slope. Group 3 had a more gentle slope and didn't improve as much as group 2. Group 4, again, had a more gentle slope than group 3 and they didn't improve as much as group 2. So, as I said, group 2 improved the most. And we looked at the characteristics of these homes and did some sub-analyses. They had higher occupancy rates, consumed proportionally less email communication, had slightly more site visits. So they called the Quitmo staff and scheduled more site visits, had the same phone call support and other contacts as the other groups. It appears that group 2 nursing homes, and we learned this by talking with the Quitmo staff about the various nursing homes in these groups, said, so what do you think was different about this particular group of homes? And they said, we really think it was they were ready to improve, and they committed to making the improvement, and they did. Group 4 used the most services and improved the least. These folks had more rural nursing homes. They had fewer than 60 beds, so they were smaller than the other groups. And when we asked the Quitmo staff about any things that they knew about these homes, they said, you know, they're really out there, and they feel pretty much that they're out there on their own. So they use us because they really need the support. So conclusions. Quitmo is an effective statewide program to help nursing homes improve their quality of care. The analysis of the intensity of services provides insight into the range of support that nursing homes need to improve. It also helps states plan for a range of services and to be aware that there's going to be a range of intensity across homes. It's not one size fits all. It's time for other states and countries to develop statewide or countrywide programs like Quitmo to disseminate the best clinical and leadership and management practices to improve nursing home care. I'll be happy to take any questions. Again, you can use my email I'm happy to answer and make connections for you. I wanted to let you know that this is an important website that you can use, and people from all around the world use it. And there's a lot of very helpful information about nursing home care, evidence-based practice, and lots of connections on webinars that are very helpful. And this is some of our Quitmo staff. This person has just been hired, who will be working in our Southwest region. And this is our infection control team. And these are our administrator coaches. And this is our project staff. And the project staff provides support and for the team. And we couldn't do it without our air traffic controller and someone else who keeps track of all kinds of records for us. So we really would encourage you to use our website. I also want to point out that there's a handout that I've sent a couple of pages long, I think it's 3 pages long, that will help you with some background and statistics on the program. It's been a pleasure to be with you today.